Hey, Dr. Tim Uselton here with Trinity Integrated Medical, and I gotta explain something. Today's video is kind of about a pet peeve that really rubs me the wrong way, and that is when an elderly patient comes in here and they say, I just finished with an orthopedist and he recommended that I get a shot of steroid, and that when that wears off and it no longer is effective, then I'm going to have my knees replaced. And then I asked them the question, what did they say was the cause of this knee degeneration, the osteoarthritis? And their reply to me is that the orthopedic surgeon told them that it was old age. That's really my pet peeve, because my next question is, well, this degeneration on your right knee, it's really bad, and I see that, but how old is your left knee? And that always gets a chuckle, because they start to realize it's not about the age of the joint. Their left knee is perfectly normal looking, and the right knee is fully blown out. It's got no spacing, it's got osteophytes and bone spurs. And so age, while it is a factor, because the longer something's misaligned, the more likely it is to accelerate the degenerative process. But it's not just old age. That is wrong. I have lots of x-rays of elderly patients that have good looking spines. They don't get bad because they're old. They actually get bad because they've been misaligned for a longer period of time than they should have been. And so that's my pet peeve. Osteoarthritis is not the result of age. It's a result of a misalignment. So how do you go about fixing that? Well, if you just went in and did what they suggest and replaced that knee, but it's misaligned in your pelvis and your hips are offline, then you never address that imbalance in the pelvis. And so now you're walking around with one knee taking more of the shock of every step for years and years and years and years. And, maybe one fall 20 years ago torqued your pelvis, and now every step you've taken since then has put more pressure on one knee than the other. Well, guess which knee wears out? Obviously, the one that has the more pressure on it. So if you just replace that damaged knee, it's kind of like if the alignment on your car is all jacked up because you've hit too many potholes or parking stops or speed bumps or whatever. I don't know how you drive, but you know how it is. You do things that misalign the car, the alignment, and then your tires start to wear out unevenly. In fact, your left front one on the inside may start going bald, and your back right one on the outside might start going bald and lose its tread. Well, I know the answer is not to just go replace the tires, because if you did only that, just like replacing a bad knee, and you never address the alignment, then you're just going to wear through some new tires in the same amount of time, because there's a problem with the alignment, the balance, the evenness from side to side. Something is wrong, because it's causing one compartment on one knee to actually get more stress than the rest. So our approach is, when we see knees, then we take an x-ray of their lower back, because we want to see the pelvis is level and straight. Great. Then this knee wearing out has another cause. Maybe your arch has fallen on one foot and it's changed your gait, and that's affecting you. But we do some investigation on the joints above and below the knees to make sure that we're not just going to treat your knee, load it up with some hyaluronic acid, get it lubricated, working again, and then it all comes right back, because the real source of the problem was this imbalance. So that's how knees connect to the other body parts, and it's very, very important that a simple x-ray and a low back exam usually reveals some sort of trauma, some sort of fall, some sort of slip, or maybe even a massive fall when you were younger. And people say, how in the world? I know I've never had an accident. Yeah, but you learned how to roller skate when you were 10 years old. You fell off a bike a few times, a skateboard. You might have been crazy in college and jumped off of a balcony or something. Who knows? You've done something along the way to cause some sort of misalignment that's going to put the pressure on your knees that's uneven. So we address the whole body very holistically. That's where that word comes from. We look at the whole body. We don't just say, here's a knee, let's fix the knee. No, because that fixed knee will then just wear out again. Even the replaced parts will tend to wear out. You know what, that a knee replacement, the average knee replacement in the United States, a total knee replacement with brand new titanium and plastic spacers and all that stuff and all that massive surgery, that knee is designed to wear out in another 15 years. So you don't want to start getting one or two of those, because then you've bought yourself 30 years and then you cannot have another one. There's not enough bone to cut to put a new piece of metal in there. So then they amputate your leg. So that's why a surgeon will never do a total knee replacement on somebody who's in their 30s or 40s. They'll at least wait till you're in your 50s, because that'll put you into your 80s by the time it's failed twice. So we have lots of patients that we wanted to help, to avoid the surgery, and we've done so. The treatments that we offer, I'll talk more in detail in another video about those, but they're very effective. And when you come in here and we start looking at your back and start probing you about questions, we're trying to get to the real source of the problem. What is the cause of one knee wearing out more than the other? Or maybe it's both knees, but it's one compartment within those knees. Something's changed the way you walk, and we can figure what that is. So I hope that describes knee osteoarthritis and how it relates to the low back and the hips. And there's more videos to watch. I appreciate you watching them. Reach out to us, comment, like the video, share it with your friends, especially if you know someone that has a bad knee, and we can get to the bottom of it. We're TrinityIntegratedMedical.com, and it's Dr. Tim signing off for now. Thanks.